In this video, I will cover whether getting stem cells for a chronic shoulder injury can help fix the problem. Expect to learn the following. Why does an injury happen in the first place? What type of issues do stem cells claim to fix? Why the majority of stem cell treatments are a waste of money? Is there any time when they may be beneficial? And why there are no shortcuts or magic fixes when it comes to fixing injuries? For those of you who don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. Just a reminder, if you're dealing with chronic pain from an injury and you're struggling to get some real answers as to what is going on, you can submit your questions directly to me. And if my insights can help, I'll be sure to get a video out to you. This week's question came from Lisa on YouTube. Let me read it real quick. I'm 35 years old and have been dealing with a nagging shoulder injury for the past 3 years that hasn't responded to any treatments, including deep tissue massage, chiropractic, intense physical therapy, acupuncture, and 3 rounds of cortisone shots. My MRI shows that I have some damage to the joint, specifically the labrum in the shoulder. The orthopedic doctor told me I'm not a candidate for shoulder surgery yet and just need to wait until it gets worse, so it will be approved by insurance. Who in the hell would want that? I'm starting to get desperate and tired of the pain and just want it fixed. I did a consultation with a local regenerative medicine clinic, and they think I'm a prime candidate for stem cell treatment. The only issue is it's extremely expensive, and they seem to be just a bit too confident that it will fix the problem right away. Any advice on to what I should do to make sure I get the right treatment and don't just waste my money and get suckered? So, are stem cells a good treatment to help fix chronic shoulder injuries? First, let's just start with why an injury happens in the first place. So, I always say, think of an injury, and in the middle, you have like a stand, and then on each side is like a teeter totter. One side is load, and the other side's capacity. Load is what you do, capacity is what your muscles can take. When your load exceeds the capacity, that's when an injury happens. Now, sometimes you have a huge load that comes in, maybe an accident, a fall, some type of trauma, but a lot of times load is just slightly more than capacity over time, and then it starts to break down. And a lot of times there's no like real true mechanism of the injury. It just kind of came out of nowhere. So what happens is when that load is increasing, the body actually starts to lay down this stuff called adhesion, also known as scar tissue. It's like a glue that gets inside the muscles, in the fascia, around the nerves, and it really makes it harder for the muscles to stretch and contract how they're supposed to. It also makes them weaker and less flexible. And over time, what happens is now those muscles can't generate the force that they need to. So it puts more pressure on the bone, the cartilage, the disc, and the tendon. And a big question that I'm always asking when I'm looking is, was there an actual injury or not? And a lot of times when there wasn't a true mechanism of an injury, it's just a compensation and biomechanical stuff is getting all whacked up and messed up. A lot of times I'm thinking if there's damage to the bone, to the cartilage, to the disc or the tendon, a lot of times that's not the actual problem. The actual problem is the underlying problem in the tissue. So what type of issues do stem cells, claim to fix? Definitely bone problems, cartilage problems, disc problems, and tendon problems. So why are the majority of stem cell treatments just a giant waste of money? Listen, there's levels to these. I've heard Joe Rogan talk about some of the stem cells that he's gotten, where you go out of the country and they cost like $50,000, $100,000. Those are the crazy expensive ones. Maybe those ones actually do work, when you're paying that high level, you're getting like the best of the best. The problem is most of these clinics that are popping up all over America tend to have like these lower quality stem cells. They might charge anywhere from $5,000 to $10,000, but they're not the good ones. And a lot of times people think they are, and the doctors present that, and it's really not getting to the best results. So a lot of people spend the money thinking they're the same as those really high end ones that you got to go out of the country for, but a lot of times they're really not. So the problem that you're running into, especially with the stem cells, like I said, if it's going after the bone, the cartilage, the disc, or the tendon, it's going in there and trying to fix that problem. But that problem is actually the effect, it's not the cause. I always say, think of those problems as like your thumb and it's stuck inside a car door. the car door is all that surrounding adhesion. You can't give this a chance to heal up if you don't fix this in the first place. So if you just go get the stem cells, but you don't fix that, that door is going to continue to slam down on that thumb and cause that problem to get worse. So is there any time where they might be beneficial? Well, I'd say first off, start with actually getting quality treatment to the surrounding adhesions in the fascia, in the ligaments, in the nerve entrapments, in the muscles. Then get in there and start to clean up your diet. Don't eat a ton of garbage. Don't eat a lot of inflammatory foods. Get your body in a good place. Actually hydrate and move your body each day. Then build up some strength around the area. And after you've done all of those things and you're still having some lingering issues, then go get some stem cells. They might actually help to heal the bone, the cartilage, the disc, and the ligament. But if you try to fix that first and you don't address any of the other issues, that's a problem that you're going to run into. So why are there no shortcuts or magic fixes when it comes to injuries? The problem with stem cells is they don't require the client or the patient to have to do a lot of work. They're very passive and not active. If you're overweight, you're stressed out, your diet sucks, you get winded walking to the refrigerator, you don't do any movement, you haven't had your tissue cleaned up in a long time, you think that this magic stem cell is going to go in there and just fix all your problems and not have any effort on your part. There's always a toll to be paid by the body. There's no simple quick fix, and that's what people fall for all the time. They're like, oh, I don't have to put any effort in. I just can go in there and, get this magically fixed and not change any of the problems that actually caused this in the first place. One trick I would say to you, though, that could really help you is to see if the doctors are actually full of nonsense, is say this to them. Say, how about we do the treatment, then get an MRI of the area 6 months later and see if it actually improved. If not, I get all my money back. If they truly believed in the treatment and knew that it would work, they'd have no problem with that. But I bet they won't. And that's another sign that you're probably getting suckered. So that's all I got for you in the video. If you've been dealing with chronic injury for at least 6 months, maybe you've seen way too many providers, you're still having issues, then reach out to us directly and set up an injury consultation to get some real answers as to what is going on and get on the path to long-lasting pain relief so you can stay away from pain pills, injections, and surgeries, which only make things worse. All the information to request a consultation is in our profile or wherever you're consuming this video. I appreciate you watching and have a great day.